Right. So it's an honor and a pleasure to really have someone who can share a good perspective as to how the government sees mental health today itself. We have on board joining us to open the keynote session, the Parliamentary Secretary of the Ministry of Communications and Information, as well as the Ministry of Health of Singapore, and also a Member of Parliament of the Jurong GRC, Ms. Rahayu Mahzam. It's a real pleasure and honor to bring her to share a bit more about her views and how she sees mental health and to open and kickstart the Mental Health Festival. So without further ado, thank you all for being early. I'm going to pass it over to Ms. Rahayu Mahzam to kick off the session. Thank you very much.
Thank you very much, Dilaric. Hello, everyone, distinguished speakers, ladies and gentlemen, good morning. It is my pleasure to join you today at the inaugural Mental Health Festival Asia. I would like to thank Intellect for organizing this conference to foster learning and create meaningful conversations surrounding mental health, and I am confident that it will be an enriching time for participants. The COVID-19 pandemic has been a great stressor on our physical and mental health. To safeguard physical health and lives, we have had to put in place various safe management measures, which have resulted in significant reductions to physical and social interactions. With decreased social interaction comes the very real risk of social isolation. Social isolation, economic uncertainty, and fear of family members or friends getting infected have all contributed to distress among our population. These also underscore the wide-ranging impact that the pandemic has had on our society. In Singapore, the Institute of Mental Health found that between May 2020 and June 2021, about 13% of the general population reported experiencing depression or anxiety symptoms since the pandemic started. You may have experienced such symptoms yourself, or know family members, friends, colleagues, students, patients, or clients who have had similar experience during the pandemic. Even in the absence of mental health symptoms, some have experienced a state of low mental well-being and feelings of stagnation and emptiness amidst the pandemic. Known as languishing, this refers to a lack of motivation and focus, even though there are no mental health symptoms present. It can be thought of as a middle state between being well and flourishing and having a mental health condition. We should not overlook these experiences and feelings because languishing has been reported to be a risk factor for the development of mental health conditions. This is an issue of concern fueled by the ongoing pandemic. The pandemic has brought many mental health issues to the fore. In response, various initiatives have been implemented at the national level. For example, we set up the COVID-19 Mental Wellness Task Force last year to coordinate and integrate agency responses to tackle the psychosocial impact of the pandemic on the population. We set up the National Care Hotline in April last year to provide psychological first aid and emotional support. The hotline was designed to address anxiety and adjustment issues related to the pandemic, and it has received over 50,000 calls since its launch. Many of our public sector agencies have also responded with several initiatives to help Singaporeans through these difficult times. For example, the Health Promotion Board, HPB, and the Ministry of Culture and Community and Youth launched a campaign called Brave the New towards the end of last year, encouraging Singaporeans to take proactive steps to support their own and others' mental well-being. It reached 2.1 million Singaporeans, with 3/4 of those surveyed reported being more motivated to self-help or help others in their mental well-being. Following this campaign, HPB rolled out the Hi Just Checking In initiative in January this year to equip Singaporeans with the appropriate skill to help them identify and reach out to those who may need support. We hope these efforts will help to build a supportive community in which individuals feel encouraged to seek help if they have difficulties coping. As we seek to build a supportive ecosystem, it's equally important that our discussions and efforts to improve mental health are done in an inclusive manner with the engagement of all relevant stakeholders. It is in this spirit that the government launched the Youth Mental Wellbeing Network last February, bringing together the wider society to ideate and develop solutions to improve the well-being of our youth. Over 1,500 individuals from all walks of life responded. Just last month, the network has moved to its call to action phase and now welcomes members of the public to join over 20 projects looking at important areas such as strengthening peer support and increasing emotional resilience. as we transition towards a COVID-19 resilient nation, challenges to our health, healthcare system, and economy will remain. We can expect that the psychosocial impact of the pandemic will continue to be felt for some years to come, with knock-on effects on our mental health and well-being. Therefore, it is apt that we have evolved the COVID-19 Mental Wellness Task Force into an interagency task force on mental health and well-being to address the population's mental health in the longer term, with a focus on cross-cutting issues across agency lines. This new task force will bring together different agencies, ministries, and stakeholders involved in mental health care. It aims to coordinate and ensure better service delivery while also optimizing policies, resource allocation, training, and capability development. Through this task force, we hope to take the lessons learned from the pandemic and continue to enhance our mental health efforts for the longer term. Concurrently, we have also been increasing the capacity of our community mental health services under the Community Mental Health Master Plan. As of last year, we had over 220 general practitioner partners and 14 polyclinics providing mental health and/or dementia services across the country. We've worked with the Agency for Integrated Care, AIC, to set up 50 community outreach teams in partnership with social service agencies, SSAs, reaching out to thousands of people with mental health or dementia needs. We have also established 21 allied health-led community intervention teams to provide mental health interventions such as psychosocial therapeutic interventions and counseling for persons with mental health needs in their homes. Moving forward, we need to think outside the box and develop mental health and healthcare solutions that are innovative and that harness the power of technology. One such example is the online platform mindline.xg, rolled out by the MOH Office for Healthcare Transformation. On this website, members of the public can understand their own state of emotional well-being using a self-assessment tool and access relevant mental health resources and self-help tools. I'm heartened to see that this festival brings together a diverse panel of speakers and participants from different industries to speak on a wide range of mental health issues. I am hopeful that this meeting of minds will be an excellent opportunity for new and innovative solutions to be developed in response to our dynamic mental health challenges. I wish everyone a fruitful and fulfilling time at the festival. Thank you.
Thank you very much, Ms. Rahayu. I'm just going to bring myself back to the main screen. Okay, perfect. All right, thank you so much, Ms. Rahayu Mahzam. That's a fantastic opening session. Really appreciate your thoughts and sharing about how you see mental health in the space as well. As I know myself, I know that you are a big proponent of actually supporting residents in your jurisdictions, as well as looking for ways to support students and women in Singapore to actually support them in Singapore and actually how we can empower them as well. So I really appreciate your feedback and thoughts as to how we can, across Singapore and with the government, what you guys are actually doing to drive more effort and support for mental health. So thank you very much. It's a real honor to have you open our festival. I will let you run to your next event, but thank you so much and appreciate you joining us today. All right, I'll see you soon, Ms. Rahayu Mahzam. Thank you.
Thank you, Theodoric. Take care.
Take care.